Welcome to today's edition of our program focused on African women's health. This is a program that is committed to promotion of African women's health at home and abroad. We share the global message for all, and we continue to emphasize that African women must not be left behind in optimal health. My name is Dr. Olaide Ogunshiji of the School of Nursing and Midwifery, Western Sydney University, Sydney, Australia. Last week, we brought you a special edition on the International Women's Day, and we concluded by saying that the global message of better the balance, better the world is a message that needs to be heard often in rural and remote areas when the message is most needed. Today, the promise is to focus on sexual violence or abuse. Sexual violence or sexual abuse is any sexual act or attempt to obtain a sexual act or other act that is directed against a person's sexuality using force or coercion. This can be any person regardless of their relationship to the victim in any setting. Sexual violence, according to the World Health Organization, is one of the violence that is recorded. And according to World Health Organization, each year, up to 1.4 million of the people in the world lose their lives to violence. For every person who dies as a result of violence, many more are injured and suffer from a range of physical, sexual, reproductive, and mental health problems. Violence places a significant burden on national economies, costing to various countries in terms of billions or millions of dollars, depending on the currency of the country each year, in terms of healthcare, law enforcement, or even lost productivity. Sexual violence includes rape, sexual abuse and coercion of adult and adolescent women. It also includes child sexual abuse, sexual torture, sexual violence in a situation of war, and also trafficking of women and girls for sex. There are a number of risk factors that are associated with sexual violence. Some of the risk factors include the beliefs in family honor and sexual purity. Another risk factor is that of ideologies of male sexual entitlement. There is also the issue of lower levels of education, which then goes on to perpetrate sexual violence and experience of sexual violence. Weak legal sanctions is also another risk factor. Witnessing family violence can raise a great risk for sexual abuse. Antisocial personality and disorder, as well as attitudes that condone violence. You may be wondering, what are some of the health consequences of sexual violence or sexual abuse? Sexual abuse can lead to short or long-term physical, sexual, and reproductive health consequences. It can have fatal outcomes like homicide or suicide. It can also lead to unintended pregnancy, induced abortions, gynecological problems, and sexual transmitted infections. And especially in 2013, for example, analysis found that women who had been sexually abused were 1.5 times more likely to have a sexually transmitted infection when compared to other women who had not been sexually abused. They are also twice as likely to have an abortion. Sexual violence, particularly during childhood, can lead to increased smoking, drug and alcohol abuse, and other risky sexual behaviors later on in life. There are a number of prevention strategies that we can think of, and some of these include reducing childhood exposures to violence, teaching safe and healthy relationship, challenging social norms that promote male authority over women, ongoing education, of course, and elimination of gender inequalities in employment and education. There are a number of assessments that have been done to determine effectiveness of some interventions that have targeted prevention of sexual abuse. If we look at high-income countries, interventions such as advocacy, counseling, and improving access to services to survivors have proved to be effective in prevention of sexual abuse. Meanwhile, in low-income countries, women empowerment programs that tend to empower the women economically and socially through programs like a combination of microfinance and skills training have been found to be effective. Other interventions that include promotion of healthy communication and relationship skills have also been effective, and some campaigns that focus on persuading people against harmful cultural norms have also proved to be effective in low-income countries. And having said this, you may be wondering, what do all this mean for healthcare providers? For healthcare providers, while prevention of sexual abuse can be considered a multi-sectoral issue, meanwhile, it's important to know that healthcare providers have an important role to play in the prevention of sexual abuse. For example, they can advocate to make sexual violence unacceptable. They can also provide comprehensive services for those that have been that have experienced or those that are survivors of sexual abuse. They can go ahead and even prevent reoccurrence of violence through early identification of women and children who are experiencing violence. Also, they can be part of data generation by participating or even leading research that aim at determining the magnitude of the problem. In order for World Health Organization to further buttress the point of the importance of health providers in prevention of sexual abuse, World Health Organization have also endorsed a global plan on strengthening the role of these healthcare providers. And at the moment, World Health Organization is working in collaboration with a number of their partners in building the evidence that are based in building the evidence to determine the size and magnitude and where and what works when it gets to sexual abuse. They are also working in strengthening research to assess interventions that have been effective, as well as supporting countries and partners to implement global plan of action. That will be it for me for today. I really want to thank you for being there and for participating and even watching me today. In case you are wondering who you are watching, this is Dr. Laide Bushiji of the School of Nursing and Midwifery, Western Sydney University, Sydney, Australia. Until next week when we come our way again, and that next week we'll be looking at the issue of oral health. Once again, thank you very much for being there, and I look forward to seeing you next week.